Bismillahirrahmanirrahim. Lecture of osteoarthritis. Outline. Introduction. Definition of osteoarthritis. Prevalence, risk factors, manifestation, diagnosis, treatment, and nursing process. Introduction. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It's occurs when the productive cartilage that's cushions the end of your bones wear down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hand, knee, hips, and spine. Definition of osteoarthritis. It is a degenerative arthritis characterized by breakdown of the cartilage with osteophytes formation. Results from wear and tear on the joint. Osteoarthritis, unlike rheumatoid arthritis, it is not an inflammatory disease. Prevalence. Osteoarthritis is highly prevalent in the USA and around the globe. It's a leading cause of disability and can negatively affect or impact people's physical and mental well-being. In the Middle East, more than 1 million people suffer from osteoarthritis in Iraq, Yemen, Saudi Arabia, and Syria. About 85% of people over the age of 75 years of age experience some symptoms of osteoarthritis. 40% of individuals with the disorder experience significant difficulty with daily activities to the point of interfering with work-related or social roles. Pathophysiology of osteoarthritis. Osteoarthritis can occur when the cartilage that cushions the end of bone in your joint gradually deteriorates. Cartilage is a firm, slippery tissue that enable nearly frictionless joint motion. Eventually, if the cartilage wears down completely, bone will rub on bone. Osteoarthritis has often been referred as wear and tear disease, but besides the breakdown of cartilage, osteoarthritis affects the entire joint. It causes changes in the bone and deterioration of the connective tissue that holds the joint together and attach muscles to bone. It also causes inflammation of the joint lining. Classification. Primary osteoarthritis caused by unknown etiology, genetic factor may play a role. Secondary osteoarthritis caused by mechanical causes such as occupational or sport injuries. Joint disease such as rheumatoid arthritis, septic arthritis, gout. Endocrinal causes such as hyperparathyroidism, diabetes mellitus, acromegaly. Risk factor. Aging. People with age more than 45 years old. Over time, a joint moves, cartilage deteriorate, and the smooth surfaces become rough. People with family history. 6. Osteoarthritis is more common in female. Obesity, including stress and weight-bearing joints such as knee. Overuse of joints. Joint injuries such as those that occur when playing sports or form an accident, can increase the risk of osteoarthritis. Even injuries that occurred many years ago and seemingly healed can increase your risk of osteoarthritis. Bone deformities. Some people are born with malformed joints or defective cartilage. Certain metabolic disease such as diabetes. Manifestation of osteoarthritis. The most common joint disease sparing no age or race. So the manifestation number 1 is pain, increased by exercise and by rest. Stiffness may occur. Crepitus sound on movement. Minimal deformity and wasting of muscles around the joint. No systematic manifestation. Morning stiffness is not usually a prominent feature of osteoarthritis. when present lasting no more than quarter of an hour. Common joint involved are knee, hips, spinal, cervical, or lumbar. Tenderness. Your joint might feel tender when you apply light pressure to or near it. Loss of flexibility. You might not be able to move your joint through its full range of motion. Bone spurs. These extra bits of bone which feel like hard lump can form around the affected joint. Swollen. This might be caused by soft tissue inflammation around the joint. How we can figure out osteoarthritis? We make X-ray and found joint spacing narrowing, osteophytes, subchondrial sclerosis. Number 2, magnetic resonance imaging, or called MRI. An MRI used radio waves and strong magnetic field to produce detailed image of bone and soft tissue, including cartilage. MRI isn't commonly needed to diagnose osteoarthritis but can help provide more information in complex cases. How we can treatment osteoarthritis? The major outline in treatment is, or we can start with exercise, physiotherapy, analgesics, non-steroid anti-inflammatory drugs with short course, intra-articular injection of steroid, and surgery. The role of nurse. Number 1, nurse assessment. The nurse assesses weight, height, and assessing gait and balance, determine presence of pain, site severity, onset, predisposing factor, and relieving factor. Lateral assessment of calcium-rich food and overall food intake of coffee, smoking habit, family history, medication history, medical history, obstetric history for female patient, number of pregnancy, joint pain, tenderness, swollen, stiffness, assessment for limitation of movement or range of motion, contraction. Extremities is examined for deformities or nodules, limitation or activity or affect self-activities. Diagnosis, nursing diagnosis. Number 1, pain related to illness process, impaired physical mobility related to pain, weakness, joint deformity, anxiety related to fear of disabilities, self-care deficit related to decreased strength, impaired mobility, pain or movement, ineffective coping pattern related to impaired mobility, risk of injury related to falling, lack of knowledge regarding disease process, treatment and complication. The goal of nurse, restoration or improvement of joint mobility, muscle strength, skeletal health, restoration and improvement of self-care, degrees of patient pain and discomfort, improve patient knowledge about the disease, treatment, prevent the complications such as fall and injury. How can we intervention? For pain, nurse must carefully evaluate pain associated with musculoskeletal problem, ask the patient to indicate the exist site and to describe the character and intensity of the pain to help determine its cause. Most pain can be relieved by elevation in the involved part, applying cold as prescribed and administer usual dose of analgesics, change position, the mattress should be firm and no sagging. Knee flexion increase comfort by relaxing body back muscles. Local heat and back rubs promote muscles relaxation, encourage core posture and teach body mechanics. When the patient is assisted out of bed, assist the patient to use assistive device. The patient gradually resume activity as pain decreases. Improving physical mobility, scheduling activity to alternate with rest period. Passive and active range of motion is determined according to patient condition to maintain joint function and muscle tone. If the patient is on bed, the nurse assists with passive range of motion to maintain joint function. The frequency and type determined by patient condition. Consult with physical therapist can assist in caring for patient with musculoskeletal disorder to maintain joint flexibility and muscle tone. Patient advised to reposition frequently and maintain proper body alignment, protecting patient joints through daily range of motion if being absent. Encourage elder patient to perform isotonic and isometric exercise such as tightening and releasing large muscles group, and avoid excessive exercise. Provide assistive devices if needed, such as crutch, cane, or walker for proper fit. It reduces the force of weight bearing by 50%. Walking, light bearing exercise, and are the most useful exercise for elderly with musculoskeletal disorder. Warm compresses can be applied before exercise and cold apply after this. Teach the patient to plan for adequate rest and relaxation technique during the day. Also teach the patient to joint protection activities such as stand and walk correct. Minimize weight bearing activity, careful when stopping or picking up objects. Wear well-fitting supportive shoes. Maintain proper body weight to minimize strain on the joint. Improve self-care to maintain the ability to perform activity daily living. The patient must maintain consistency in daily routine. Encourage as much self-care as possible. Assist only when necessary. Allow plenty time to perform task or activity daily living. When feeding, use assistive device. Feed one food at a time to taking like and dislike of patient in consideration. When assisting with dressing, over one item of clothes at a time. Use the assistive device such as a modified eating utensils, button hooks, raised toilet seats. Limited choice to do in situation where the client must make a decision, such as dressing or eating. Provide positive feedback for independent function. Thank you.